So let's get started. Welcome, everybody. Welcome. Happy Friday. Thank you for being here. We know you could be anywhere in the world, but you decided to be here with us, and we appreciate that. My name is Carlos Maruri. I'm a counselor at Compton College. I am also the chair of the Professional Development Committee for FACCC. And so thank you all for being here and putting on or being a part of this conversation of returning to campus. The goal of the webinar today was really just to have an informed conversation about the return to campus. This is not an event to provide definitive answers to anybody. I don't think there really are super definitive answers anyways. If your campus is anything like mine, there's still a lot of gray areas to sort out. And so hopefully this conversation today will give you some perspective that you can kind of take back and add on to those conversations that are happening at your campus. For about the next hour or so, we're gonna ask the prepared questions to our panelists. And then we definitely want it to be conversational in nature. So panelists, feel free to jump in where you feel comfortable and bounce off each other. We'll also include a 15-minute period towards the end for Q&A from the audience. We shared a Google link that you could put in the questions there, and we'll try to sort those out through there. Yeah, we're gonna go from there. Evan Hawkins is here today, the FACCC Executive Director. And so I'd like to bring on Evan real quick, if he doesn't mind.
Thanks, Carlos. Appreciate it. Yeah, thank you all for being here. Super excited. We have over 100 people attending. Obviously, this is an important issue. And as Carlos mentioned, that we want to hear from you all. We want to be able to share some information that'll help empower our faculty leaders across the state within their local districts where these decisions will be made. On top of that, at the state level, where, of course, FACCC does our advocacy work, these conversations are occurring as well, often around what sort of funding is necessary to support our colleges, support our faculty and our students as we talk about returning to campus. So we certainly appreciate you all attending today and engaging. I encourage you all to either, as was mentioned earlier, ask your questions, in the Google document. All of this will help also guide our organizations as we're speaking to legislators on behalf of all of you. So super excited that you all are here, and I'm looking forward to the conversation. Thank you.
Thanks, Evan. All right, so now if we can have the panelists introduce themselves, I will call on you all so you guys don't fight to see who goes first. I'm going to do it alphabetical order by last name, so it's fair, okay? So then the first one up there would be Dr. Robert Gilchick.
Yeah, hi. Good afternoon, everyone. Glad to be here. So I am a public health physician with Los Angeles County Department of Public Health. My regular role is I'm the chief over child and adolescent health section. And since January of 2020, when we activated our emergency response structure for a COVID-19 pandemic, I've been focused on the education sector in our county at all levels, starting with early care and education, the K-12 system, as well as institutes of higher learning. And essentially, I'm the primary liaison between our department and the whole education sector within Los Angeles County. So very happy to be here. Thank you.
You're being here. Okay, next. Mary, and I might mess this up, Mary, but I'm going to do my best. Mary Jartensen.
Carlos, that was really good. Hardly anybody ever tries my name, so I really appreciate that you even tried it. So my name is obviously Mary Cartensen, and I am the EMT fire chair for San Diego Miramar College. I'm also EMT faculty, and I'm delighted to be here today with you all.
Thank you for being here, Mary. Okay, up next is going to be Dr. Jason Newman.
Hello, everyone. My name is Jason Newman. I'm the new president of the Los Rios College Federation of Teachers in Sacramento. And in Los Rios, we have 4 community college campuses. And I'm very happy to be here today. Thank you.
Okay, and last and definitely not least, Dorelli Pichardo Diaz.
Hi, everybody. My name is Dorelli Pichardo Diaz, and I'm a counselor at Rio Hondo College, and I am one of the co-authors of the COVID-19 Return to Campus Considerations for California Community College Counselors. Thank you so much for having me.
Thanks for being here. All right, so let's jump right into it. And the first one is, we're going to direct it first at Dr. Gilchick, and then we'll open up for the panelists. So Dr. Gilchick, can you provide us with an overview of LA County guidelines for school reopenings?
Yeah, I'll do my best and try not to use up the whole hour, because we have a pretty extensive protocol, as most colleges probably have a pretty extensive plan themselves. So I'll try to really hit the highlights. Of course, I can speak most authoritatively about our protocols and plans within Los Angeles County, but the principles are really the same, you know, across the state, across all counties, across the country, because in generally we're you know, we're aligning with CDC guidance, we're aligning with California Department of Public Health guidance. So you know, what you hear me say really probably applies at least generally to all counties and all campuses. But I think I'm going to like structure my response really in talking about the layers of protection, because you know, what we found is that there are multiple effective mitigation strategies, but none of them are as effective alone compared to you know, implementing them together and at the same time. In other words, layering them, as we say. So you know, if you think you know, if you think about a slice of cheese or Swiss cheese that has holes in it, things can get through the cheese, but the holes don't go all the way through the block of cheese. So if you line up a lot of slices together, the holes don't line up. And if it gets through one slice, it's going to be stopped by another slice, right? I'm thinking of some kind of particle or something moving through the holes. So it looks better on a slide, but I think you can imagine what I'm talking about. You know, when you see it like illustrated, it's a little bit better, but I think the principle is clear, that if you layer these strategies all together, you're greatly reducing the risk. I don't know that we can create zero risk of a case occurring on a campus or transmission occurring on a campus, as long as there's COVID-19 in the community at some level. Fortunately, across the state, you know, case rates are dropping everywhere in all counties, which is wonderful. We're poised, if we make it another week at the current low case rate levels, we're poised to go into the yellow tier next week in Los Angeles County, which is amazing. We've really seen a fantastic recovery, certainly in LA. But I mean, the first thing is you want to keep, to the best extent possible, you want to keep persons who are ill off campus and out of classes and stuff. So that has to start with some symptom screening. You know, this can be done remotely. People can screen themselves daily, but it's extremely important that anyone who does have symptoms stay home that day until they, you know, until they feel better. They don't need to be on the campus exposed to other staff, exposed to other students. So that's number one. Now, we all know that there's a lot of asymptomatic infection with COVID-19. So just checking for symptoms isn't going to keep every infected person away necessarily. So if they're assuming that someone there is coming to work or is coming to school and they are infected and they don't know it, what are we going to do about that? Well, we have a number of different strategies to limit that. One, of course, is masking. And masking is one of the most effective strategies because it not only protects other individuals from the infected person, but it also provides some protection to the uninfected individual who's wearing the mask as well. And that's why masking really needs to be universal and 100%. So everyone, you know, everyone coming to work, everyone coming to school at the campus really needs to be wearing masks whenever they're in any, you know, in the vicinity of any other people, really. You know, indoors, we basically say the only people who don't have to wear masks are people who are in their private offices, you know, with the door closed, you can take off your mask. But if you're going to be around other people, you know, you've got to be wearing a mask that fits well, you know, covers the nose and mouth. It can be disposable, it can be reusable. The important thing is that it's sort of tightly knit and tightly woven. It doesn't have, you can't knit yourself a mask. That won't work that well. It's gotta be, you know, well woven material, multiple layers, fits fairly snugly against the face, over the nose and mouth, and you know, along the sides of the face. That's an adequate mask and provides protection both to people around the individual and the individual themselves. The second thing is physical distancing. We still need to maintain physical distancing around each other. 6 feet is the standard at this point, or ideal, at least for adults. You've probably may have read or heard that there's now lower standard in the K-12 schools that are allowed. That's based on some research that showed that school children in those age groups, they can sit within 3 feet of each other in a classroom, you know, with the other protections in place, masking, etc. And it doesn't seem to increase the risk of transmission or the number of cases or outbreaks. However, there are different profiles of transmission, susceptibility, infectivity, or infectiousness with children compared to adults, older adolescents and adults. So for college age students and adult staff and faculty, we still are using a 6 foot distance. That's whether a class is indoors or whether a class is meeting outdoors. There still should be 6 foot distance. Indoors as well, there is a limitation on how many persons we can get in you can put in the classroom. It's always limited by distance because there has to be enough room for everyone to have their physical distance space around themselves. But even in your very, very large classrooms, your very large lecture halls, currently we hope to get to yellow, but we're still in orange in LA County. So our limit right now, based on the state guidelines, is that lecture halls can be occupied up to a maximum of 50% of the room capacity, and or up to 200 people, whichever is fewer. So if you have a very, very large lecture hall that seats, you know, more than 400 plus people, you could theoretically go up to 200 people. That's 50%, that's 200. But if it's smaller than that, right, then the 50% is going to be less than 200 people. So 200 maximum. Again, so those numbers could vary a little county to county based on the tier that you're in, or other local considerations, but that's what we have in our protocol. We're still always emphasizing good infection control with hand hygiene. People should be washing their hands multiple times a day. If you don't have, soap and water is the best. If you don't have access to running water at a certain point in time, hand sanitizer is a reasonable alternative. You can use hand sanitizer, you know, with a minimum of 60% alcohol base. And the other issue, I think we may get to this later, talking about indoor air quality. So I don't know how much detail. I'll hold the details till a little later. But of course, we want to pay attention to ventilation indoors in particular. That's another reason we emphasize outdoor activity or classes whenever possible, because the dilution factor outside is infinity, right? There's lots of it, you know, the air exchange is immediate, and you're always replenished with fresh air when you're outside. When you're indoors, there are many ways to improve ventilation, and maybe we can talk about that, you know, with a later question. But obviously, there's some limitation to the rate of air exchange. So there's always a little bit more risk indoors than outdoors. There's exposure management is extremely important. What happens if there is a case? What happens if a student or staff member does test positive? There's a, you know, that sets in motion a certain cascade of isolation for the symptomatic or or test positive individual, and some degree of contact tracing in terms of who is likely to be exposed to this individual. There is a definition for close contact within 6 feet of an infected person for more than 15 minutes within a 24-hour period. So it could be cumulative 15 minutes over a 24-hour period. That person is considered a close contact and a possible exposure to the infected individual. That person is instructed to quarantine, and that person should test as well to see if they may also have converted and been positive. Our public health department is always available and supports any site in the community that does have cases and potential exposure. We will kind of walk you and talk you through that, and so that you're not doing it on your own, you're not lost, you're not, we will give you as much guidance and leadership as you need to assist with that. I think the last thing I'll mention before I stop, which is probably our newest mitigation strategy, but maybe the most important one, is vaccination. And the two after that are vaccination and vaccination. That's really, this is our, this is our pathway or our ticket out of this pandemic, honestly, is to get as many people vaccinated as quickly as possible, so we reach what we call herd immunity, which is when a high enough percentage of the overall community and population have sufficient immunity that it basically stops propagation of the virus. It doesn't mean that there aren't any susceptible people left. There probably always will be some, because we never get to 100% vaccination. So it doesn't mean that we'll never see, I don't know if we'll find a time where we never see another case of COVID-19, but there's so few susceptible people when you reach herd immunity that you don't see a large outbreak or epidemic or pandemic occur. This is a person-to-person illness. So if there's very few susceptible people, there's not that many places for the virus to go, and therefore the herd immunity stops propagation of the virus. So it not only serves the community at large and is the ultimate way to end this pandemic, but it provides great protection for each individual who makes the effort to go and get their full vaccination, which is 2 shots for Pfizer, Moderna, 1 shot for the Johnson & Johnson vaccine. But the risk of serious illness and death once you are fully vaccinated and immunized drops dramatically, from a little, probably the risk of death for someone, the average risk of death for someone who's not vaccinated, is less than 1%, but 1 out of a couple of hundred, 1 out of a few hundred. When you take the vaccine, your risk of dying from COVID-19 is more like 1 out of a million, which is almost 0, right? So that's, it's hard to argue that. I mean, the evidence is pretty clear on how effective it is at protecting us. So I'll end on that. That's probably the most important message I can give, which is let's keep getting vaccinated. And for those of you who have done it already, congratulations. You've helped yourself, you've helped your family, you've helped your community. Tell all your friends. Thank you.
Thank you, Dr. Gilchek. And for the rest of the panel, if you wanted to jump in and maybe discuss how your campuses have aligned or attempted to align with your own county's guidelines, we'd love to hear
it. I'm happy to share. So we're San Diego County, and I don't believe that we're that dissimilar in what we're doing. So we were told to go to completely online March 2020, which we did, which was very difficult for EMT and fire programs because we're such hands-on programs, but we did do it. And then seriously, most of the heavy lifting in going back to on campus was convincing the 4 college district that we could actually do that work. I have a nursing background, and all of the people I work with are either EMTs and or paramedics, and the firefighters were pretty much the same because firefighters to be EMT or paramedic. So I really had to do a lot of convincing that we were capable of that, and that was something that we did, and that was something that we were teaching our students to do. So they finally let us go back in June of 2020, and we were able to do skills at that point. So to Dr. Gilcheck's recommendations, we did really aggressive screenings, which means I wasn't one of those people that like, oh, the student could just screen online, take their own temperature and come in. I just don't trust people. So I like to put my eyes on them. So really it was me. And then I convinced the trainers to help me and a couple of the instructors, because people are like, well, I don't really want to do that. And I was like, well, look, this is the job that we're in. I just kind of ran it like a triage in the ER. And so I lined them up, distanced them, get a questionnaire, have them fill it out, took their temp. How you doing? How you feeling? Just like, just like you would anybody, friends, family, patients. So I thought that was a really successful strategy. I would email the students in advance and say, you're coming on campus. The minute you get out of the car, you need to wear your mask. You need to stay 6 feet apart. Please don't come if you're sick. If you're sick, we will turn you away. It wasn't meant to be punitive, but it was like, we have to keep ourselves healthy. So number 1, we can continue your education. And number 2, we can prove to the college that we can do this without disease transmission. Then once they were in, we put them in pods of 10. And sometimes just 8, and it was really expensive, but part of our CARES Act was amazing in helping us to mitigate some of the expense. And we got our students through, and we got them NREMT psychomotor exam skills tested without any disease transmission. So we were allowed to come back and stay back, at least for our skills component. We moved online for all of the lecture. And then just recently, as things are lifting and people are more comfortable in what we're doing with our programs, we're now kind of consolidating those little 10 pods into 20 students in a room that's like, 90 student capacity. We have some rooms that you can completely like open all of the doors, all of the windows. It's like an open air room. So we've been doing that. Our students are amazingly compliant. They appreciate the fact that we are able to come back and provide education. Some of our skills are a little bit more challenging. We were very concerned about teaching blood pressure measurements and pulses and things like that. So in our fall semester and in our summer semester, we were like, well, let's just not do it because we weren't comfortable and we had to distance. But moving into spring, I was like, hey, we can do it. We can do it safely. We can screen our students. And we did it. We did it very safely. I mean, they were a little closer than they should be, but we knew that that would happen. Now, my last point is, so last week I decided that I would, and I had trouble with this, but then I was like, I'm just going to do it because these are people that are going to healthcare professions and they need to know how important it is for the provider to be healthy in order to provide appropriate care. So I gave them 5 points for getting the COVID vaccine. So you cannot believe how much that incentivized these students, because even though there's 1,000 points to pass the class, everybody wants 5 points. They were like, Mary, can I get my 5 points? And I was like, yeah, show me your vaccine. So moving forward to Dr. Gilcheck's point, like I totally agree 100%. And in our summer cohort, I'm going to be like, hey, you guys want to join our program, you have to be fully immunized. That's just the way it's going to be. And we want to go to the hospital and we want to be able to do our clinicals and give people robust education so that they're prepared to take care of people in any environment, but particularly a pandemic environment. Thank you for letting me speak.
No, thank you, Mary. Did anybody else want to jump in on that?
Sure. In Los Rios in Sacramento, we're still in the red tier. But initially, when we were, of course, sent home in March of 2020, we did immediately bring back some health courses on ground. And as Mary was mentioning, these were courses related to nursing and the allied health field. We had 15 of those courses that remained on ground a year ago. And through all the different processes of social distancing, mask wearing, symptom checks, testing, that went very well. That continued through the summer. However, we did have several students test positive, and so there was some quarantining taking place. In the fall, we added 22 more impossible to convert courses, largely workforce courses like welding or construction that could not be taught online. We added those courses back in the fall, again, with social distancing and other requirements. For us in Los Rios, we're looking at a conservative adjustment to county protocols. Although we do and did have the ability to have courses of 25% students in the room, our district, with union negotiations and our approval, went for a more conservative approach for safety reasons. And so we only had last year 15 health programs and then 22 impossible to convert to online programs offered in Los Rios. This semester, we've broadened that out a bit to include other impossible to convert courses. And the plan moving forward is to broaden more in the fall of 2021 to add lab related courses, especially in the sciences, athletics, and other courses that are taught quite often outside, like horticulture, for example. So we've added some of those back, planning to do so in the fall. And in general, our district, again, is really opting for a much more conservative approach, including no plan to mandate vaccines either, like most community college districts in California. Thank you.
Hi, so I'm from Rio Hondo College, and so we are following LA County restrictions. And so the approach that our campus has taken was starting with a COVID-19 task force. And so we got constituents from across the campus, and we have a couple members of our administration going to teleconferences with the LA County Health Department for updates. They report back, and we've been able to put together some guidelines for our own campus of, how to move forward once we are back on campus. We also have a few programs that are on campus, like Fire Academy, Police Academy, nursing, and a couple of CTE programs. And so they've been able to use the protocols set forth by the LA County Health Department to determine what would be the safest approach for those areas. And so I think the importance of communication is important across our campus, because each area has its own intricacies, and they're slightly different. And so that constant communication with each other, it has been very important, and having a space where different constituency groups can come and talk about what the limitations are for their respective areas has been critical in helping us move forward.
Thank you, Dorelli. And so with that, what can college, and this is for everybody, what can colleges do to set those new normals to ensure that we're going to remain healthy, both physically and mentally, to do the work of supporting students and ensuring their success as well as ourselves, in your opinions? Anybody can jump in wherever you want.
I believe that they need to be open and willing to actually do some work that they have traditionally not been asked to do. Like really talking to the students and asking about their health, taking a temperature, making sure that people are healthy when they come to class. In my opinion, we should have always been doing the work and making sure that people are healthy when they come to class. Like I've always wanted to be like, hey, you know, you don't look good. You're coughing. You seriously need to go home. Okay. And this is just the way that it is, but it's probably my background, and a lot of people don't feel that comfortable with it. However, moving forward, I think we're just going to have to be more aware that there are disease processes out there. They've always been there. This one just happens to be really communicable. And it happened to really take its toll on the population. So going forward, I think people are just going to have to be really more aware of what's going on in their environment. And maybe you're going to have to do a few extra things. Now, I know some faculty are not comfortable with that, but my opinion is, and since we're dealing with students are our main focus. It's like when I worked in the hospital, your patient is your main focus. So get out of your head, get out of your space, and do what you need to do to make it work. Now, that seems really simplistic and maybe Pollyanna-ish, but no, it worked in my area. It's working for fire. It's working for AVIA, AVIM, all of our aviation, all of our auto, all of our diesel. So in our science programs, but I think people are just reluctant to be accountable to our new normal.
In Los Rios, and from my vantage point, we need more resources to help us with mental health challenges for our students and our faculty. That's something in the fall that I'm hoping we can all improve upon. Also, the idea that students and faculty need further technology upgrades to be able to effectively communicate with students and each other. That's part of the new normal that I think really needs to be addressed. And finally, mask wearing is something we've been talking a lot about, how to enforce that in classrooms, what happens when students might not have a mask or refuse to wear a mask. That's another issue that we're still negotiating the safety parameters around to try to find a common ground to move forward and so that everyone can be successful.
I think one of the things that our campuses can do is just look at this as an opportunity and see like what are some of the things that we've gained. And I think some of the gains that we've made is just a new level of comfort for maybe students who in the past were not as comfortable with technology. You know, so like the word Zoom is a much more common term, right? We all understand it. A lot of our students are so much more comfortable with it. In my area, which is counseling, we've definitely seen an increase in students showing up for their appointments because they're showing up on Zoom. You know, it's easier to send a text message to a student, hey, are you coming to your Zoom appointment? And they don't have to drive anywhere. They could be like, oh my goodness, or they don't have to take a half a day off of work because they can just log in during their lunchtime and still do their counseling appointment. And so there's a lot of new opportunities. And so I do think that this is a chance for us to maybe reframe how we do our work and really think about what are the things that are actually working since we've transitioned and try to get the best of both worlds. And also to get that support from our administration to allow us to be creative and not be so quick to go back to what used to be, but maybe think about what are some of the things that we've learned through this and how can we implement it into our own campus practices and into the new normal.
Yeah, I appreciate everyone's comments. Most of all, I think Dr. Newman really took the words out of my mouth about focusing on mental health as well as staying healthy physically. And you know, I don't know what the usual counseling or other mental health resources are available on most of your community college campuses, but yeah, there's no doubt we could probably use more. I mean, this just has been traumatic for everyone, you know, emotionally and physically. Many of you faculty on here and many of your students have lost people close to them. You know, Los Angeles County we have had over 23,000 deaths from COVID-19 since the start of this pandemic. We'll probably reach 24,000 before it's over. I hope we don't reach 25, but that's a mind-boggling number of people, and that's a tiny fraction of what's been lost across the state, across the nation, and the world. So this is really traumatic, and I think it perfectly reasonable to have conversations about this, you know, even in class, or, you know, with your students, among your peers, to just try and get a grip on what we've been through. I mean, it looks like we see light at the end of the tunnel now. So there's a lot more hope and optimism, but we all have to go through something of a grieving process if we haven't done it yet. So I appreciate that, and I really like Dorelli's comment about you know, the fact that these type of events does change culture. I mean, I don't know that we'll ever, here in the county, I don't know that we're ever going to have everyone back in the office together again, because people have gotten used to telework, and, you know, there'll be some sort of hybrid attendance, you know, shifts on and off, more use of virtual media and meetings. And there's nothing wrong with that. You know, it's not someone my age, that's not what I'm used to, but change is okay. It's unfortunate that we need this type of event to, you know, for that sort of evolution to occur. But, you know, maybe in the long run, we'll say something positive came from this, and, you know, so thank you.
Thank you all. And we know this will be a little bit of a heated or debating topic. So if have your campuses considered mandatory vaccinations, why or why not? What should kind of be considered, or what should be spoken about when considering or creating a vaccine mandatory policy?
In Los Rios, we have Sacramento State and UC Davis within a half-hour driving distance from our 4 community college campuses. And we often try to stay in alignment with Sac State because a lot of our students transfer there. However, it does appear that Sac State and UC Davis will mandate the vaccine and Los Rios will not. And we do need to remember that Los Rios is approximately 97% online in the fall. Sac State and UC Davis have a much different breakdown than we do. Given the fact that very few of our students will be on ground, it does lend to the idea that we shouldn't issue a mandated vaccine. I think some of the concerns that have been discussed include equity barriers that the vaccine represents. Will some of our students not come to campus if they are enroll, if they feel that the vaccine is mandatory or is mandatory? Also, the issue of enrollment in general. We're not sure if a mandated vaccine would lower enrollment numbers in Los Rios. We are approximately 8% down in enrollment, fairly average throughout the state. But that concern has been addressed or brought up by management. I'm the faculty union president, so I err on the side of safety in my deliberations. And so I welcome the idea that vaccination is not mandatory. However, we do have obviously robust online offerings, and for students in the fall, that'll be their safest opportunity to get an education in Los Rios. Thanks.
Well,
Go ahead.
Go ahead.
Go ahead. Go ahead.
Well, thank you. I would just say, from the government perspective, or the public sector perspective, at least, of course, in California, vaccine mandates generally come from the legislature in terms of school entry mandates. I think that as a public health department, we're not recommending mandates at this time. Vaccine mandates. We're kind of silent on it for a couple of reasons, related reasons. One is because the vaccine's very new. all the data we have show them to be very safe and effective, but generally more time it passes and more data is recorded before a vaccine are required for people. And the second thing, and this is again kind of related to the newness of the products, is that none of them have yet received full FDA approval and licensure. They've all been authorized for emergency use only. So as you may know, the announcements from the University of California and California State University systems are that they will require vaccine, but the requirement doesn't go into effect until the products are actually fully licensed and approved. Sometimes that gets missed. And those full approvals could still be a number of months away. It may or may not be in place by fall. Generally, FDA approval of new products is a very slow process and can take a couple of years. It might be accelerated for these products because they were already put into wide use through an emergency authorization. So all of the usage data that normally would accumulate more slowly, we're getting a lot more of it in. So that might allow quicker approval, but it's hard to predict when the full approval comes. I can tell you what we are most concerned about regarding risk on college campuses, which doesn't generally affect community colleges, except in a few instances, because you all are mostly commuter colleges. But the congregate living that goes on, on most four-year colleges and universities is really the big risk, especially if the people who are living in the student housing in congregate situations are not vaccinated. So although we're not requiring it in our protocols, we are recommending that institutions look at consider a requirement regarding their housing, and that it does make sense to us perhaps to require a vaccine for those who are, for students who are going to be living in the dormitories for institutions that have on-campus housing. Again, I don't know if it can be required at this time, but we would say any student who's not vaccinated and would be living, if they are permitted to live in a dormitory or congregate housing situation, should probably not share rooms. We would really like roommates to be fully vaccinated to protect each other. So that's our current position on vaccine requirement or mandate at the college level. Thanks.
At Rio Hondo, we're following guidelines, we're monitoring, we're watching, we're reading articles. We're seeing that the UCs and the CSUs have already made decisions about that, but we as a campus have not made that decision. But I do think we need to just be aware of our communities and the communities where our campuses are located. We service a large portion of Latino community. And I think within that community, there's still a lot of education that needs to take place and some trust building about vaccine safety. And so that might take a little bit more time. And so I think depending on where you're located and the population that you're serving, I think that piece is also important when we talk about equity and access. But as far as making a decision has not been made on our campus.
And Mary, I know you mentioned your program was going towards that way. Is there any talks of that expanding to the rest of the college or the district?
That's a totally different conversation. So at this point, I would say I think very few decisions have been made to allow multiple programs to come back on campus. Currently, we have like 8 programs on campus. And I think because mine is definitely an EMT program, people are more amenable to doing those things, because literally we would, when we were able to go to the hospital, which were able to do, and on our ride-alongs, our students had to be fully immunized to participate. And that was the only way we could get the clinical contracts that we currently have. So in my mind, it's just natural that we would include the COVID-19 vaccine. So I am a little bit on the pushy side. So I just say, hey, you know, you want to participate, you need to keep yourself and you need to keep your patients safe, because it's not fair to go out there and communicate disease to people who are already sick. That's my feeling. So that's what I say, and you like it, you don't like it. I don't know what our campus is going to do, but I sure will do my part to help us be safe and to put providers out there who are healthy and who are considerate to their community.
Thank you for that, Mary. All right. So next question. What sort of consideration should be taken into account for counselors and librarians, and how is that different from instructional faculty?
I'll go ahead and start with that one. So I think because, you know, librarians and counselors are in the classroom, but a lot of their work is also outside of the classroom. And some of the unique environments that these faculty work with is oftentimes they're in spaces that tend to be communal, where a lot of students tend to gather. And, you know, there's no way it's difficult to mitigate that, because this is a hangout spot, like a transfer center, a career center, a study area, or study rooms, right? Private study rooms that we have sometimes available for students in the library. And so it's difficult to mitigate that. That's why it's so important to have faculty from across the campus in the conversations, again, because our areas are so unique. And so we need to think about those communal spaces. We also need to think about, in terms of counseling faculty, we're in very confined spaces. Our offices tend to be relatively small, and so it's difficult to even have 6 feet of distance. If I'm wearing a mask, and the student's wearing a mask, how do I pick up on nonverbal cues, right? With a student, how do they see what I'm saying? You know, providing empathy for the student, because I think some of our work is going to transition a little bit as counselors, where we really need to take that socio-emotional piece and help students work through that at the beginning so that they can be successful with the academic piece. And so still being able to build that rapport with students. But how do you do that if you're in a confined space with a mask? And even us as professionals, I may very well feel nervous in a very small confined space. Am I going to rush the student out of there? Whereas if I was maybe in an open air area, or if we were still doing it virtually through Zoom, where I feel more comfortable doing my full 45 minutes or an hour with my student, as opposed to feeling like, oh my gosh, that student sneezed, you know, trying to rush through this. And so, you know, those are things that, you know, we're human, and it's a pandemic, and we're not sure how it could potentially affect us, but we also need to keep in mind how it's going to affect students. So I think, again, seeing it as an opportunity to be creative, maybe having tents outside, continuing to provide remote counseling services, remote library services. I think all of those are great opportunities for us to consider. And that's why I believe that we have to have a variety of faculty at the table having those discussions, because often the discussions surround the classroom environment, and we might forget faculty that are, you know, making efforts in other areas.
In Los Rios, where, as I mentioned earlier, over 95% of our offerings in the fall will be online, we still do have the need for approximately 10% of our counseling hours to be held on ground. And as Dorelli was bringing up, the distancing factor is really important. Counseling offices are quite small. And so because we have other classrooms available, we're going to spread out our counselors, give them sufficient space to meet with students in larger classrooms. Also, we're going to add plexiglass where it is needed in places so that counselors are able to meet with students more closely. Also, one issue we've learned about a lot directly from counselors and students is the need moving forward in the new normal to permanently provide counselors with remote work rights. Currently, counselors in our district do not have the right to work remotely, but of course, we recently have had to do that, and so in the new normal, counselors will be able to work remotely as part of their regular load. Some students want that remote counseling opportunity. With librarians, similar to counselors, a lot of close work with students in a confined space. Librarians are also, like counselors in our district, unable until very recently to do any of their work remotely by contract right. That's changing. We're negotiating that. And also for librarians, a lot of new technology to create touchless services. For example, lockers where books can be put for students to come along later and grab those resources. So librarians sort of in the back of the house with unfortunately classified members sometimes doing the frontline work in a library setting. That seems to be the direction we're heading in the future in Los Rios.
Marian, I wanted to follow up with you specifically about this one. I know you were part of those hard to convert classes. Have you kind of been like a template now for what's going to happen moving forward in your district?
Yeah, yes, pretty much so. Because we were one of the few programs that came back as early as we did. So I think a lot of the programs that came back probably structured their program very similar to what we did or what we are currently doing. So, yeah.
So for the next one, and this was brought up, I think, a little bit, Dr. Newman, you had mentioned it, but so how are your campuses planning to use federal funding to assist in outreaching to the thousands of students that we've lost, or even to adjust to this new normal?
I talked to our chancellor about this question to get some more information, and one thing we're doing is we're calling all students who dropped last semester. A lot of phone calls being made. Also, we're reaching out to financial aid experts to try and use stimulus dollars to connect more financial aid to students. Also providing more Chromebooks and hotspots to students as well. The technological divide is profound in terms of the ability of rural and urban and suburban neighborhoods to access faculty through technology. That issue has been, to my surprise, very uneven within all three of those sectors. And so those are some of the ways that we're trying to do some outreach directly and really interact with students meaningfully over the phone and Zoom to find out why they dropped and how we can help bring them back.
Just wanted to share something that our campus did. Our campus didn't experience as many students leaving as other campuses did. And I want to attribute that. I'm really proud of our campus. They did a lot of that phone calling as soon as we hit the pandemic. You know, a lot of reaching out, you know, that human contact over the phone, knowing that somebody cares about you. I really think that that goes a long way in connecting with the students. And I'm really proud of my campus because I think that has a lot to do with why we didn't experience as many students leaving. And even if they didn't have all of the answers, we have something called a warm handoff. It's like, I don't have the answer, but let me connect you with this person who is going to have an answer for you during a time where it was chaotic, especially right when the shutdown happened. Nobody knew what was going on. And so I think knowing that there was a live person that they could talk to and implementing a live chat feature where students can connect with somebody, I think that really went a long way.
Mary, for all the supplies that you had to kind of pull together to convert your classes. That funding came from the district, or was it where did that come from?
So initially it came out of our own pockets because I was so focused on us coming back that myself and one of my coworkers just bought a ton of disinfectant, and we just did a lot of really creative things, but we always kept our stuff clean. Like I would have the students clean off the desk after every single class meeting, just because they were going to be healthcare workers and they're going to clean an ambulance or clean their workspace. So I just thought it was a good idea to start teaching that those types of behaviors. And so myself and a coworker bought a bunch of stuff. He bought a bunch of hand sanitizer. We put it everywhere. We put our spray everywhere. I did a ton of laundry. We did a bunch of weird bleach stuff. I mean, we just went full bore. And then eventually when the district started coming around and getting funding, we were allowed to access masks and hand sanitizer and spray, disinfectant spray. So that we received through CARES Act funding. So they sort of at a certain point, and then they were like, "Whoa, we really need to get on the train and give these people stuff that they need." So that was good. And now, you know, we're running so many programs, including lifeguard programs, that anytime you ask for it, it's just like, here you need, this is it, just to keep students healthy and safe. So I'm really proud of our district. I know that it was difficult for them to allow us to go back, and I know they didn't have the comfort level. But my point is, if we're interested in student success, and if you have people who are willing to do it, capable of doing it, comfortable doing it, then you need to put trust in your faculty and in your staff to do that work. And when they did that, it allowed us to create a prototype that was actually really successful. Now, I'm not saying everybody would be comfortable in doing it, but you know, we did provide students the opportunity that would not have been able to actually finish their course of study. So I was really glad and grateful that we could do that. And I think we can continue to go on and do that, and to help other campus partners to feel more comfortable when they transition to going back face to face.
All right.
But I really believe immunizations are the way to go. I know that people are not comfortable with it, and I understand that, but in order to keep our population healthy, we're going to need to really make people understand that that's not something that they should fear. And I think that's going to be the more difficult challenge moving forward, even for faculty, staff, maybe even administrators and students. So that to me, I see is the real big issue at this point.
So for the last,
Oh, sorry.
go
If
ahead.
I could just jump on. I wanted to kind of coattail on what Mary was saying about the cleaning and disinfection, because our understanding and our emphasis of that has shifted a bit, a little bit away from that. Not that it's not important to clean. We want cleanliness is next to godliness, good stuff. But but the almost obsession, we've had my word that, you know, in early months about disinfecting everything all the time continuously, which is really not possible to be, you know, you can't disinfect everything every time someone touches something. And that was creating a lot of anxiety, right? A lot of distrust. And I think what we've learned is that this transmission by fomites means inanimate objects that transmit infection. You know, the doorknob, the desk, the table, whatever it is, you know, is more theoretical than real. We don't know, we really don't have documentation of people getting infected from touching inanimate objects. Theoretically, it makes sense. You can think a pathway of how that would happen. Someone touches their secretions, touches the surface is wet. Someone else touches that surface, touches their face, nose, mouth. There you go, it's infected. It can happen, but there were a lot of touches that had to happen for that to get there. So what we've realized is that's not as big a risk as we thought. So the focus from CDC on down has been now less focus on, constant disinfection, more focus on regular cleaning, just keep things clean. But most of all, everybody be responsible for their own hands, for washing and sanitizing their hands. Because even early in the pandemic, I was doing talks to some of our sister agencies, departments in the county, and they were worried about this. And I said, look, you can't hire a person to stand next to the Xerox machine and disinfect the pad every time somebody uses a Xerox machine. If you can, that's great, but I don't think we really have the resources to do that. But if every person washes or sanitizes their hands before and after they use the Xerox machine, no contamination on the Xerox machine and no contamination on your hands. So by keeping yourself safe, you're keeping everyone else safe. And I think that's where our emphasis is now. But now for a healthcare environment where Mary is training people for healthcare workers, it's a different standard. But for, the classroom or the office, just standard cleaning is probably adequate.
I'm glad that you said that, Robert, because you still didn't change my mind with it. I'm still going to tell them that they need to clean stuff after.
Yeah, absolutely.
I love the cleaning part of it. Our place has never been cleaner, and it totally serves my narrative. So I'm just going to continue on.
In Los Rios, we have a separate union for classified and a separate union for faculty. And it's been interesting talking to my classified counterpart about their own negotiations with the district over cleaning procedures moving forward for custodians. And so we're allowing, or of course, agreeing to the idea that these custodians, of course, know what they're doing. They are the experts, and faculty are not, outside of the health side of course offerings. Faculty are not experts in cleaning. And so I'm really hoping that the district sets up a policy where there's minimal efforts of faculty involved in the cleaning process. Again, coming from a faculty perspective outside of the health course offerings.
I drew the line at the toilet, so I couldn't do that. So
just spray that one down.
I just let the maintenance people. It was talked about, though, that we would do that too. And I was like, no, thank you. I already cleaned my own at home.
Mary, did you have any students test positive?
We actually did, but not through us. I mean, they obviously did. And when they did, they were very good about letting us know. And then, at the beginning of the pandemic, some of them weren't able to come back because our program was very short. But we had them stay out for like 14 days. And then they had to come back with a negative test. And it was fairly easy to manage. I worked with student health services a lot, but to be honest with you, I had such good communication with all of the students that I was individually send them, talk to them, how are you feeling, what's going on, all of those types of things, so that we could make them feel like they weren't some sort of pariah, and like these things happen, they're young people, they're social. And then hopefully when we brought them back, we could kind of do some remediation for them. So yeah, we did. Did we ever directly trace it from students on our class from one student to another student? No, we never had any of those cases. But like I said, we were really stringent and focused on what we were doing. They wore masks the whole entire time. But what we did do is we used to have really long class sessions. So what we did was I shortened them to like maximum 3 hours. And at the end of the 3 hours, I would literally say to them, like, you guys, you need to get your stuff. You need to go wash your hands. You need to get out of here. You need to go home. You need to hydrate. You need to do whatever. And I didn't let them eat or drink in the classroom either at all. I just was like, no, that if you need to do that, you need to go outside in the fresh air and do it. So I really tried hard to create a healthy environment that the students would appreciate and maybe even learn from. So, and I think we did a fairly good job. And I'm saying to the rest of you on here, I totally understand your position. I understand counseling, I understand all of the other disciplines, but it was, for me, it was a little bit more natural. It was easier because that's my background. So I felt really comfortable doing it, but I hope in showing people my comfort level, like, oh, I'm comfortable doing it, the students did really well, that other people would be like, well, you know, if they could do it, we could do it. Maybe not to the same degree or intensity, but it's possible to provide students that new normal experience and bring our students back to complete their difficult hands-on training that you just cannot do over Zoom. Zoom serves its purpose. However, it's not good for a student to learn how to, you know, do like take a blood pressure over Zoom. That failed miserably. It was ridiculous. So, you know, everybody has their constraints.
Thank you all for that. So we're getting close to time. I'm going to move on to the audience questions. I'm going to skip the last one. You guys have kind of touched on all that stuff anyways. I'm going to try to ask the ones that haven't been touched on so far. So this one says here, does the insatiable desire that the Chancellor's Office appears to have for maintaining online classes even after the pandemic spell doom for the future of community college faculty teaching in person? It's a bit much, but whoever feels comfortable.
I think there'll always be a balance between remote online offerings and on-ground offerings. The question is what the percentage balance really is. Some administrators would like to take us to a much higher percentage of online offerings, even 50% versus 50% online on ground. You talk to different faculty, they have different opinions about how much online should be part of the community college experience. In Los Rios before the pandemic, we were approximately 10% online. With the pandemic, we think moving forward, when it's over, will be 20% online in the new normal. I think that's largely where we should stay based on what I think I know about faculty desires online versus on ground. There's a lot of equity barriers that are presented by online education. And I think that's becoming very clear in our communities. And for myself, it's been an education too, discovering that really on ground is the preferred method of instruction for faculty and students alike.
I don't really see it as doom and gloom. I do think it's more just rethinking like what we do, who we're servicing. We have a lot of non-traditional students that need other formats, like how can we be creative and innovative and still providing the same services and class offerings to students, but really asking ourselves, are we serving the population that's there, and just maybe monitoring that, asking the students themselves, like, what do they want? You know, what would be best for their schedules? What would help them reach completion sooner?
We'll go to the next one. What do you do if your college's administration does not comply with CDC guidelines? Example given, require maintaining 6 feet social distance when the CDC has lowered it to 3 feet. I don't know if anyone has experienced that.
Well, I can tell you
We're still 6 feet, right? Go ahead, Dr.
Yeah.
Gilcher.
No, I can tell you what we would do in LA. I mean, we have a number of ways that constituents, if they're feeling unsafe, there are avenues where you can file a complaint or share your concern with the Department of Public Health. I mean, initially we really try to take a very supportive and soft hand with our education partners. Our experience has been that in virtually all cases, it is the intention to create as safe an environment as possible. Administration is not trying to cut corners intentionally and place people at risk. So we look at it as an opportunity for TA education. We respect the confidentiality of the complainant, but we'll work with the institution to share what's been communicated to us and just see what their challenges may be. Is this true, and how can we help you mitigate this issue if it's true? Now, if there is continued non-compliance, or it appears that it is fairly blatant or intentional that the institution does not want to comply, we have a heavy hand too. we can issue citations and so forth, but that's been we've done that a lot with some restaurants and other businesses. It's very rare with anything in the education sector, because as I say, I think usually everyone's acting on good faith so that we can mitigate these problems when they do arise.
Although our district has decided to err on the side of caution, if we did catch wind that our district was violating state or county health guidelines, we would immediately bring that to their attention. If they decided not to sit down with us, we'd file an unfair labor practices charge with the Public Employee Relations Board. We'd also go to the media here in Sacramento, which is really easy to do, to draw attention to that violation of protocol.
Thank you all. So the next one, if you have been vaccinated and are teaching a class in pronunciation, where students most benefit from seeing how to make the sounds, what suggestions to teach in this case? I read it verbatim, by the way.
It's an interesting question, and I'll just add that we recently negotiated for our deaf studies faculty the right in spring of 2022 to remain online, because they cannot teach the skill set with students wearing masks inside of the classroom on ground. It's a unique field in that sense. And so they will remain online for the foreseeable future until mask policy doesn't exist anymore, which I'm very curious to hear from anyone, Dr. Gilchick as well, about how long mask policy he thinks might be in effect moving forward beyond fall 21. Very curious about that, as well as social distancing as well. If those two factors disappear, social distancing and masks, it's a game changer for us in the community college system.
Yeah, I'll respond. First, there are some alternatives and accommodations to the standard masks. They're actually, they have, I think, anticipating this particular need, there have been masks produced that actually have a transparency, where you actually can see the mouth moving. In addition, we do have an exception in our protocol for this particular need, where a faculty member can substitute a face shield with some sort of drape attached that they can tuck in. We can't say that it is parallel or similar effectiveness to a well-fitting mask, but it does block some of their respiratory secretions. And if they are able to, say, increase the distance between them and other persons in the classroom, we find that an acceptable alternative. We haven't offered that to all students in the class. So if they have a similar need to have their full face seen, we really haven't come up with a good solution for that. As far as when will masks be, masking policy be lifted completely, we're already seeing some CDC taking some steps with what they've issued about vaccinated persons outdoors not needing to wear masks. We're not lifting that in our workplace or institutional policies, but just in general, I suppose a person who's outdoors now, we're probably going to match that in our new health officer order, where as long as they're not in a crowd, as long as there's still proper physical distancing between them and others outdoors, they can consider not wearing a mask. The downside of that is, in terms of enforcement, there's almost no enforcement or assurance, because how does one know who's vaccinated and who isn't vaccinated? So that's the downside that we've seen. But I suspect by the fall, I don't have a prediction in terms of timeline, but by the fall, I do think we're going to have a much higher percentage of our population vaccinated. And that might mean that there are some further loosening of restrictions. I don't think masks are going to go away fully in the fall. Especially particularly indoors, like indoor classrooms where there are multiple people from all from different households. So.
Hold on. Okay, the next one, let's see. So if we start going face-to-face indoors in the fall, and one student in my class at some point in the semester tests positive, will the whole group of students have to quarantine for 2 weeks? This is currently happening in the class of my first grader. They sent all the kids home for 2 weeks, while the kids are sitting apart during the lesson time in school. Says they still have to quarantine and make everyone stay at home. So the first part, just the first part.
I'll address that. When we were in a much more critical part of this pandemic, when we were in purple, when we were having, one of the worst surges on the planet back in December, January, we had that policy. Whereas if there was a cohort in an ECE setting, a public school setting, or college setting, although most of our colleges, again, did not have on-campus classes at that time, we would say quarantine the entire cohort, quarantine the entire class. As we've started to recover, we've moved away from that. And now we take it on a case-by-case basis, and we only quarantine those who are identified to be close contacts by the criteria I mentioned earlier. There could be a time where it's difficult to determine who in the cohort or the class was a close contact and who wasn't. If that's the case, we might very well quarantine the entire class, but it's not automatic. It's on a case-by-case basis. So I think that might be a county-specific guidance. It also could be institutional. Because public health says you need to quarantine individuals A, B, and C, doesn't mean that the institution or the organization can't choose to say, let's just send everyone in the classroom home just to be safe. That's not unreasonable, at least not at this point in time. Maybe a year from now, that'll really be overkill, but it may not be unreasonable now. So we don't oppose that. We just like a county can be more restrictive than the state guidance, a private or separate institution within the county can choose to be more restrictive than the county guidance, and that's perfectly acceptable.
Thank you. I'm trying to go through some of these. Audience, if I didn't ask yours, I'm sorry. We're running low on time. Do any of you have an opinion on MERV 13, 6 air changes per hour with use of HEPA filters to augment areas where airflow is insufficient? Have those been any conversations? Have you had any of those conversations with Dr. Gilchuk?
In Los Rios,
yeah.
Go ahead, please.
Go ahead, Dr.
In Los Rios, the HVAC issue is paramount. Airflow is crucial, and we've been negotiating that. And we have guarantees that all of the HVAC filters will be changed with the most up-to-date and most expensive, actually, filters available. We've heard from faculty that they want to have doors and windows, open. That's a good idea. And August 7th is when faculty regain full access of their offices. And by that date, all HVAC filters will be replaced.
Yeah, I was just going to say, whoever the questioner was, I think they've researched this. I mean, everything they've mentioned are good strategies for improving indoor air quality and air exchange. You know, fresh air coming in is fine. Opening the doors and windows are great when that's possible. You can even kind of artificially create, you know, a pass-through current with a fan, say blowing out the window. That's perfect. Don't have a fan in the room just creating turbulence. That's not good. But a fan, say in the window, that creates, you know, a through current. That just increases the rate of air exchange, which is great. Yeah, if you you know, we recommend HVAC systems be inspected and make sure they're operating at their maximum capacity in terms of 100% outdoor air exchange. And yes, the MERV 13 or higher rated filters are recommended. And last but not least, freestanding air purifiers, you know, HEPA filters are also recommended as an excellent addition when needed. As far as air exchanges per hour, you know, I think the minimum we're shooting for would be probably 4 to 5, but if you can get it higher, 6, that's great, you know. So that's, you know, an air exchanges per hour of 4 means every 15 minutes, the air is fully, you know, is fully turned over in the room. If it's 6, that means every 10 minutes the air is, so the higher that is, the better, but, you know, probably, you know, again, the 4 to 6 range is very reasonable to shoot for.
Thank you. I'm going to try to combine these next two. So what percentage of your classes are opening on your campus? They gave an example that their president is trying to open 50%. And with that, are you limiting the cap size? Are you shortening it? For example, if a standard cap size is 48, is there any plans to reduce that to say 20?
We're offering math and English classes at reduced class size in the fall. Those are the only courses that will operate under reduced class size. District has indicated that in smaller class sizes affect our fiscal side in terms of the amount of funding we receive. So in that sense, we're not doing what seems to be the better option, which is to reduce class size across the board and bring as many students in as we can, as UC Davis and CSU has done. But our enrollment and funding system is different. Our funding is based on enrollment, unlike CSU and UC. And so that gives us different concerns to have to think about.
I believe in our region, the campuses all around our area are anywhere between 25% to 80%. And so our campus is working on 25 to 40%. That's the number we've allotted for ourselves. But again, we are working, I believe it's called an environmental hygienist, which is a consultant coming onto campus and helping us do walkthroughs. And our campus just did walkthroughs like of a classroom, of a lab, different spaces on our class, so that we can teach each other how to mitigate the spaces that we have. And I think depending on the space that's available, that'll determine how many classes are actually going to be on campus. But just like Mr. Newman, a lot of the focus is on classes such as math.
Okay, so how about this one? So can students be mandated to take and test negative on a COVID-19 test prior and throughout the semester for on-ground classes? Has that been a consideration amongst your campuses?
We have no plans for widespread testing. However, our athletes, our health practitioners, as Mary was describing, those limited courses have been able to have testing on site, but I don't foresee that as expanding outward to other students in other courses.
All right.
Yeah, I just would want to add in, we also, we recommend testing as one tool that can be used. And one other layered mitigation strategy, we don't compare testing with vaccination. Vaccination is a solution, testing is a strategy, right? And I mean, we don't know that testing needs to be done widely or mandated. If you want to know, I mean, whether you can mandate is a legal question. You can, I would call LAUSD, since they are mandating testing on everyone and every student in order to come back. But that was, not necessarily our recommendation. The one thing I would point out is, although testing certainly will find some cases, and testing can then, in some way reduce the number of cases you may have on the campus. The reason I say it's not the solution is because, one thing is a person can convert positive the day after they take a negative test, or an hour after they take a negative test for that matter. Secondly, even when you identify someone as positive, it may very well be that they've been on campus in the 48 hours previous, and there may already have been exposure. So although it's been helpful, I mean, definitely helpful that you were able to identify that individual, you still haven't necessarily prevented all exposure. You still have to identify who's been in close contact. There still may be people who have to quarantine and test themselves. So again, for those who have the resources and choose to do asymptomatic screening testing, that's fine, but it doesn't substitute for all the other strategies I had talked about earlier.
Well, with that, we are at time. I want to give our panelists just one final opportunity to share any final thoughts if you wanted to. Take it away if you want. If not, I'll close this thing down right now.
As a student advocate, I really value seeing the students in person. And my opinion is we should do everything that we possibly can do as educators to provide students opportunities to learn in environments that they're comfortable in and that they'll learn the best in. So I think all of us are commonly vested in that tenet.
Thank you, Mary.
As a union negotiator, I think it's imperative that districts sit down with faculty and listen to those who are in the trenches, those who are doing the work in interacting with students, and take faculty ideas and considerations into mind when creating policy for everyone.
Thank you, Dr. Newman.
I guess I'll just say that, first of all, it's been a pleasure to be part of this distinguished panel, and for those who are, who have been listening and have been in attendance and may understandably have some degree of apprehension, some degree of concern about reopening and coming back to campus. I hope that there's also some excitement about it, and I think from the public health perspective, I think certainly by the fall, I think we'll be ready. This can be done. This can be done in a safe way. Education can proceed, and I'm excited about seeing our community colleges populated again and lots of people learning. So anything we can do to help, we're here. Thank you.
And then I just think that a soft return back would probably be best to manage where everybody is. We are all at different stages of comfort level, and we're all here to advocate for students. And so everybody needs to feel well equipped and confident about returning to their classrooms and to their duties on campus. So a soft return and allowing everyone to voice what that looks like for them and giving everybody the grace to give us that transition period. It was a harsh transition online. Let's make it a softer, more manageable transition back on campus, both for students, staff, and faculty.
And with that, again, I want to thank the panelists for giving up part of your Friday to be here with us with FACC. We appreciate you. To all the participants, thank you for taking part of your Friday and giving it to us and listening. We wish you a very, very happy weekend, a healthy weekend, and stay safe, everybody. Keep those conversations going.